or wherever you are. Um, Thank you so much for joining us and for being part of our Essential Substance Abuse Skills webinar series. I'm Kate Trams, and today we have one of our wonderful trainers, Matt Ignacio, here to speak on group counseling. This training series is brought to you by the National American Indian and Alaska Native Addiction Technology Transfer Center. We are one of 4 national focus centers serving the ATTC network, which also includes 10 regional centers and a network coordinating office. To learn more, please visit our website. This series is designed to be a broad overview to assist in preparing for written alcohol and drug certification exams, to enhance existing knowledge, and to improve overall competence and treatment outcomes. Please be aware that this series is not meant to stand alone, and previous education and training is necessary in order to pass alcohol and drug certification exams. Our center is an ADAC certified educational provider, and CEUs are available on request for a $15 fee. A request form is available for download in the Files pod in the webinar screen, and we will also be sending this in a follow-up email to all who attended. Immediately following today's webinar, you will be redirected to our GPRA evaluation. SAMHSA asks us to evaluate our events in order to comply with the Government Performance and Results Act and to provide improved performance assessment and accountability. The survey will ask about your satisfaction with the event and will take less than 10 minutes to complete. We thank you in advance for helping us to improve our programs. You will be muted for the duration of this webinar, so if you have questions about the presentation or about the Adobe Connect system, please use the Q&A pod by typing them in the field at the bottom. We will address questions at the end of the presentation, so feel free to submit them at any time, and we will probably take a question and answer time at the very end. Today we are welcoming Matt Ignacio, who is an enrolled member of the Tohono O'odham Nation and has been working with us at the ATTC as a consultant and oversaw the adaptation of our forthcoming LGBT and Two-Spirit curriculum. Matt has also worked with the National Native American AIDS Prevention Center and the Michael Palm Center for AIDS Care and Support at Gay Men's Health Crisis. Matt is interested in increasing healthcare access and utilization, as well as improving culturally respectful service delivery for Native people and other underserved and marginalized populations. He also wants to help build on and increase trusting and meaningful relationships between researchers and Native communities. He's currently a doctoral student at the School of Social Work at the University of Washington. Thank you so much, Matt, and I'll pull up your slides at this time.
Thank you. Appreciate that. That was a very comprehensive introduction. Good morning, good afternoon, wherever you may be. My name is Matt Ignacio. I'm a member of the Tohono O'odham Nation, which is a tribe located in southern Arizona, and I'm currently right now in Seattle, Washington. So hello from the Pacific Coast. I want to just echo what Kate just said about helping. I do feel it's important that we, or Native, non-Native, whatever the case may be, that we really work to help improve our services to those that are most marginalized, most ignored, the folks on the fray, the fringe of the fringe, if you will, because that's really, I think that's what I feel most comfortable being and speaking to and working with in those spaces. So in that spirit and in that honor, if you're having a little trouble engaging Native clients in some of your services or programs, this webinar is for you. And it's going to be in 2 parts. So the first part is really just kind of breaking down what group counseling is. And then the second part is really kind of the bread and butter when we talk about group counseling with regard to Native clients. Because we do have to approach things in a different way. And I can maybe offer some insight or some helpful tips in the work that you're doing. So please, if there's any questions, feel free to put them in the chat box. If there's an issue with the volume and my voice, if you just don't like the sound of me, you can go ahead and put that in the box too. But I like you, and we'll go ahead and begin. Okay, so let's talk about the how-to with regard to groups and group work. So there are different types of groups, and let's just kind of break those down now. First off is our educational groups, and the purpose really is to expand client awareness of behaviors and consequences, and really to help motivate folks towards some kind of change. So psychoeducational, there's a little bit of support, mutual support going on. There's educational pieces, didactic pieces. The education component comes through. And so at the end of however long this group lasts, I ran one that was a 12-week group. At the end of 12 weeks, folks walk away from a process that had a beginning, middle, and end, and that helped them change or examine some aspect of their drug or sexual risk. Next is skills development groups, and the purpose really is to cultivate skills people need to achieve or maintain abstinence, and it operates from a cognitive behavioral orientation. We also have cognitive behavioral groups, and the leader focuses on providing a structured environment within which group members can examine the behaviors, thoughts, and beliefs that lead to their maladaptive behavior. And we also have support groups, and probably most of all of us have heard of support groups or are aware of what they are intended to do. And the origins really begin in the self-help tradition. The goal is to offer social support, which is unconditional acceptance, inward reflection, mutual support, etc., between participants. And it's especially useful for apprehensive clients. You can suggest it as a safe environment, and it's a place to help destigmatize and to talk honestly about any problems or shameful, or what we might think is shameful behavior. I'm specifically talking about support groups around maybe overeating, or I had a client once who was very involved in Sexual Compulsive Anonymous groups or Debtors Anonymous. Whatever the case may be, these are spaces where there should be no judgment. We can communicate that to our clients. All right, let's talk about group membership. In other words, who is in these groups that I'm speaking of? Well, they can be fixed and they can have revolving membership. In other words, that's often referred to as having an open or closed group. In open groups, new members enter the group when they are ready. In the closed format, groups begin and ends with the same membership. So I was talking about the psychoeducational group that I ran. It's 12 weeks. I believe the first 3 sessions were open, so folks could come, decide if it's for them. We always encourage the folks to come back, check it out again. But by the 4th session, we closed it off, so that way, there was a solid core group of members, and which helps increase trust. We'll talk about that a little bit later. But that's kind of almost a mixed approach, if you will, having both open and closed. There are some pros and cons to both styles, whether you're going to look at, if you're interested in more of an open group format or a closed group format, and you can see on the slide on the screen. And it's important that before we place a client in a particular group, it's important to remember that we need to consider the client's readiness. Is your client actually ready and interested and open to the idea of group work? Maybe they aren't. Maybe they're still in a place where one-on-one feels the most safest and most natural, and that's fine too. But we got to kind of make those determinations, and that's also a conversation you would have with your client. Hey, there's this opportunity opening up. This new group's going to start next week. Seems like something you might be interested in doing. Do you have any interest? That kind of conversation. Let me see. And again, before placing a client in a particular group, clients may need to move to different groups as they progress through treatment, or as they encounter setbacks, and or as they become more or less committed to addressing problematic behavior. I'm going to pause for 1 second. There's a little bit of an issue with me being hard to understand. Let me know if that's me. Actually, I just need to slow down, or if that's a volume issue, or if that's a connection issue. Okay, we'll be a little bit. Okay, thank you. Continuing on with group membership, we could also have groups that are voluntary or involuntary. Involuntary groups are basically when we mandate, coerce, whatever the word you want to use, folks to get involved in group work. There might be legal obligations, it might be court ordered, there could be family pressure. You could be running groups in juvenile detention centers and jails. Folks are mandated to show up to group. That is an involuntary group. It's important to remember also that self-motivation to change can inspire other group members and positively impact the group culture and norms. So, in other words, there are going to be people, there will always be people who show up, who are mandated to show up to group, who don't want to be there, who are very resistant and sort of hard, I'm using all the buzzwords, hard to reach, quote unquote, non-compliant, quote unquote. But I believe that the real artwork, and this is going back to my original opening statement, the real art of this work is actually to engage those folks that are hardest to reach. And that is, I think, a gift, it's a skill, it's whatever you want to call it, but it takes practice. And what I wanted to point out here is that there are some upsides to involuntary groups. You might dread it, you might have fears about it, you might not want to go that route or do that work. But, things happen in group. Miracles happen in group work. I've been a witness to seeing change in group. And that's why group work is really kind of one of my favorite things to do in terms of behavioral health. I'm no longer a therapist, but I do like to facilitate group work. And seeing that change can inspire other members and be hopeful and open to that if you're currently or having to do mandated groups in the future. Consider that folks can help each other, motivate each other in the process. We also, in terms of group membership, also have voluntary groups. And voluntary group members often assist in providing motivation for folks who may not really feel like this is for them or may not think there's necessarily a problem. It's that peer-to-peer sharing that kind of pushes the needle, if you will. Voluntary groups can certainly serve as effective mentors to other group members. So that mentorship, right, that peer-to-peer model is effective. And again, self-motivation, seeing others motivated, certainly can be positive, have positive effects on other members. Very often, clients indicate primary mode of help is through mutual support. So you run a group, let's say for 12 weeks, let's say you wait about a month, you send an eval form and you ask them, what was the single most thing that helped you in the whole group process? And they're going to say, most likely, the friends they made, the connections they made, that they didn't feel alone, that what they were going through, someone else was going through too. Those kinds of statements is what you might hear if you ask folks what was the single most important thing that they got from group work. So in other words, unfortunately, friends, it's not myself or it's not you that's the most important, but really it's building that mutual support between participants. And you and I can both relate. You want to see your classmates when you roll into your favorite class, or when you go to your favorite coffee house, or you want to see your favorite barista, or book clubs, weight loss clubs. The content and the facilitators are critical pieces of the pie, right? But we can't underestimate the power of people and our peers and as we're learning how to change and evolve and grow as humans. Those members who self-reported improvement were significantly more likely to have felt accepted by the other members. Again, we're making friends here, we're making connections, we're building relationships, right? There's a perception, so folks also say that there's a perceived similarity of some kind among group members, so that they felt particularly committed or connected to specific members in the group. And that's a great thing too. When talking about groups, we can also make a distinction between self-help versus mutual help. And as I'm talking about these in sort of black and white, binomial or like dyads, I'm not pitting one against the other, and these clearly are not exclusively one or the other, but I'm just kind of mainly showing the differences. So with self-help groups, there's an implication that the individual in treatment is the main contributor to the change process. Whereas in mutual groups, means that the individual also assume partial responsibility for the recovery of their peers, right? And that can look like So we see this very often when um, folks act out of line, or maybe are disruptive, or show up to group high or under the influence, and perhaps there's a group norm that says, you will not come to group under the influence, and someone does. It's the actual other members who kind of regulate and hold everyone else, hold their peers accountable. And that's also very powerful to be witness to as well. Let's talk a little bit about implementation. So as facilitators, we are responsible for establishing the parameters for the group. We are responsible to provide general behavioral expectations and clarify the purpose of the group. You might do this already and have like group norms or group values, group rules, guidelines. I would advocate that if you're going to write, if this is something in the group where you were wanting to do and you want to have it posted so everybody can see the group values or expectations, I would probably not say rules or agreements or guidelines, because that can be kind of, it sounds a little like authoritarian, very school. Like, to me, if someone said these are the group rules and I'm going to a group, I would think I'm in like second grade again. Maybe we try to evolve that and call them, community agreements or group values. It's another one that is very popular. And certainly, this is a co-creation of, if we're doing group values, it can't be all your ideas, right? We got to solicit ideas from the membership themselves. We try not to make group values too complicated or too restrictive. Really, we're focusing on member safety, facilitator safety, your safety. We're focusing on honesty and integrity and respect for self and others. Excuse me, one second. Excuse me. There's also an opportunity for values clarification. We can even before we even start listing things out, we can ask folks, should we even do this? Is this something that we even think is important? And have that conversation. We want to be open to amending, adding, and adjusting throughout the entire process. And we certainly want to review at each meeting, review the guidelines or the values at the start of each meeting if necessary. All right, so there's some examples. I think you all know what I'm referring to. Certainly respecting confidentiality, right? That's always my first one when I walk into a group, because I do HIV work mostly. I always just ask, even if I'm not in a confidential space, can we just all agree that whatever we say here in this room stays in this room? Because very often in HIV work, we talk about trauma, we talk about drug and alcohol use, we certainly talk about sexual behaviors, and those are pretty private. Can we just all agree to kind of keep it in the space so we can create a safe space? I mean, that's literally what I say in a training or a workshop. You can also, as you see, encourage participation from all group members, respecting others, et cetera, et cetera, et cetera. By providing an initial overview, both individually and in the group, clients will then come to the group with appropriate expectations, and you can expect a greater degree of success. So if you are providing individual level counseling and you know of a group coming up, and again, you're going to check in with that client and say, hey, I heard of this opportunity. Are you interested? And they're kind of interested. Let's process that out by talking about what the group is by providing that overview. And it makes things run a lot smoother. All right, there are stages of group work. Forming is just as it sounds. The group is coming together. Folks may not be sure how they fit in. It's common and to be expected. The storming phase, it's a comfortable place for clients. There can be conflict in the group, and that is not to be interpreted necessarily as a negative, but that actually somebody's engaging, right? The norming stage will certainly happen after the storm. It's a period of evenness and calm. Performing stage, everyone knows their roles and the rules, and the group motors along toward achieving its task. And adjourning. Right, the termination stage. When you are going to know the group is done, question mark, facilitator can decide instead of clients, if that's in a structured group model approach, I always think the best way to end a group is to plan for the finish at the beginning, be very clear if this is a 12-session group or perhaps it's an open-ended group, it just goes on and on. I always just like to kind of offer a little bit of encouragement that if they come and they decide this is for them, you know, you're not ever going to have another chance maybe necessarily to invite them back. So kind of just, you may not see that client again. Just say, we're always, you know, we're welcoming. If you ever want to come back, please just let me know, let us know. Keep the door open, in other words. And that is probably a little tip from me to you when working with Native clients, because of just history and broken promises and all that kind of comes into play. It's like, here's another provider saying they have a solution, and then it suddenly funding ends, or the group facilitator changes jobs, or something happens to the group and the group ends. That individual, that Native client might interpret that as like, oh, they don't care. Oh, they don't care about our community, right? So we can start some of that work early on. I'm not going to get too much into the stages of group development and the leadership roles. I know that Kate will provide these slides to you all, or these will be available, in other words. So, you know, you can come back and look at the different stages, and it talks about different tasks that you might actually be, that might be helpful to kind of, to motivate and to push the group forward, as you can see. And it also highlights some of the likely group member behaviors so that you kind of have a sense of where you are in terms of the stages. In creating a group, remember that in most cases, you are the single most common element among all group members, right? They're coming in because they've had a connection with you. In shaping the group, your experience and behavior, as well as the expectations of group members, will guide the formation of norms, right? So it is kind of, you are bringing yourself, you're bringing, I think of you as bringing your spirit, your soul, your love, your heart, channeling that anger and frustration that we see and putting it to some good use, right? That is all that factors into the shaping and the norming of the group. So you want to bring in good energy, right? Healing energy. In maintaining the group, you function as a mediator, handling issues and conflicts that might arise. Your job is really to help the group function properly. Show confidence in your abilities, right? You're there for a reason. There's a reason why you're in front of the folks that you are. Remember to remain calm and objective, and always provide a safe environment to the best of your ability. With regard to facilitation, I know you guys are all star facilitators, so this is just review, right? Maintaining a safe environment, serving as a group historian if someone new shows up, or ask another member who's been there a while to help share the history of the group and the experiences. It's okay to have fun, have a sense of humor, use your professional judgment, right? And certainly if you can get group members to start saying I statements, you know you're doing well. For the facilitator and co-facilitator, there is a little bit of a breakdown. By no means is this concrete. It's just kind of how I envision this. The facilitator obviously is prepared, responsible with consent forms, sign-in sheets, greets and welcomes each participant is important. I should actually move that to number 1. If you're facilitating a group and you're working with folks who are marginalized or on the fray or apprehensive or seriously don't want to be there, please make an effort to greet and welcome each participant warmly. They may not greet and welcome you back, but you know, be consistent. Do that every time, because I guarantee over time folks will warm up to you, right? We all do that. We all warm up when folks are nice to us, or at least that was a weird statement. Never mind. Let's talk about the co-facilitator. There are some roles and expectations for the co-facilitator. This just actually happened recently. I suggested to the lead facilitator, I was basically the backup. If we could just sit opposite each other so that if we need to make eye contact, we can. And that's what I prefer to do. So avoid sitting side by side. One person can be in charge of nonverbal cues. One person, the co-facilitator, really is in charge of handling the room temperature, sign-in, visitors at the door, late and newcomers, that kind of thing. Co-facilitator can monitor time, help clean up, and certainly participate in any debriefing. Okay, so let's now talk about when we're working with Native clients. We've been sort of edging up to this. Right. Well, let's native communication styles can be very different in Indian country, um, with regard and or with respect to other communities. Communication styles for native clients cannot be generalized, right? However, it is an important concept to discuss when working to improve a provider's ability, your ability to work with native folks. For some native nations, tribes, and communities, if a native person looks away, this may be a sign of respect, right? And a non-native community, that might be viewed as the opposite, but it might actually be a form of respect. Native people are sometimes taught that listening rather than speaking is immediately important. This comes up when I work with other non-native trainers who go and deliver trainings in Indian country and come back and say, I went there and nobody said anything, I didn't get any feedback, it was hard to read the room, they didn't really, I don't know how I did, I couldn't tell you. And I always say, well, that's okay, you probably did just fine. And sometimes in native communities, people tend to be a little less free with the feedback. And furthermore, native communication styles, personal information about oneself and one's family is not easily shared. So I always think of this in terms of sensitive topics, right? Well, drug use, sexual behaviors, histories of trauma, those are all kind of shame-based experiences, and no one wants to bring shame to themselves or their family, particularly if you're native, because we are all related, right? So folks might be a little bit more hesitant to share. I just want to point that out because maybe you're having trouble or having issues, and just know that it probably has nothing to do with you, right? It's not about you. It's about just cultural understandings and understanding context. Moving forward, silence or minimal sharing should not be interpreted as disinterested. Where English is the patient's second language, the speech may be thoughtful and slower. And some native folks may believe that talking about a topic will it to come true. Talking about HIV in a community that believes that if talking about it is going to bring it in, it makes it kind of hard to do HIV prevention, right? You got to be creative. Just to be aware of these things. I'm just bringing these up as an FYI. And let me also say this too. I by no means mean to speak on behalf of all Native people. These have just been my experiences in the work that I've done. And I hope that you might take it and use it and adapt it. And that's what we all want here at the HTTC. We know that Native diversity is big in Indian country. Folks identify as Native American or American Indian, and Alaska Native, and Native Hawaiian, First Nations, other indigenous. 562 different recognized tribes in the lower 48. And, so how does that marry with the clinical experience, meaning group work, right? The biopsychosocial and spiritual builds upon and fosters positive therapeutic relationships. So you build this relationship with clients, right? You're building trust. That's absolutely critical for Native clients. You're increasing the likelihood of treatment plan adherence by building that positive relationship with your clients, your Native and your Native clients. And it can also help reduce client attrition, keeps them coming back, right? Building that relationship. By doing this, it reaffirms your clients as experts in their own health care, their own mental health, behavioral health, spiritual experiences. They are the experts. And we can help clients make positive change in their life once we set that working approach. So again, how does this fit with the Native worldviews? Well, most often, working with Native folks requires a shift in the delivery of our services. So how can we work from a culturally relevant perspective? Well, there is an importance of spirituality, and that's kind of where I begin, at least, when I talk about what culture means to me. And it's often part of our cultural teachings. It is part of our cultural teachings. It's something both learned, people have sat me down and said, this is what this is, but it's also ingrained in the community. So we see it in funerals and births and puberty ceremonies. For Native folks, spirituality is often a part of a holistic approach to wellness. So having an appreciation and respect for nature and the environment and the surroundings is an important aspect to health. Appreciation and respect for our health, bodies, mind, and our connection to the past is also part of our health. I have some good friends who are studying the environmental destruction on the impact of mental health of American Indians and Alaskan Natives. And it's not something to take lightly, that our environment, people, the plants, the birds, food, the water, all these things are critical elements of life, and that's part of our spirituality. In my experience, as I said earlier, taboo subjects can include HIV in comparison to diabetes. I mean, diabetes is a well-versed conversation in many Native communities, but is HIV? No. You have to ask yourself, well, why is that, right? We know that sexual behaviors, particularly among those who identify as lesbian, gay, bisexual, can be discriminated against. Folks who are transgendered can be discriminated against in Native communities. Certainly, if you're using drugs, that can be frowned upon. And general issues of modesty and privacy, particularly across gender communication, men and women communication, modesty about one's body, so take this all into consideration if you feel frustrated you're not getting anywhere with those folks, because I think it goes deeper, and if anything, the one takeaway that I would say is you have to have respect and trust before any of the work can be done. So if we're feeling that isn't really part of the landscape with the folks you're working with, let's talk and find ways on how we can increase that. I'm happy to offer a consultation, certainly at no cost, through email after this webinar. Let's talk about some cultural considerations. So there are some Native-specific cultural risk factors. You might hear folks say that I don't want to go get an HIV test because my cousin is the receptionist at the local clinic, at the local Indian health clinic. Or I don't want to go get an HIV test because my cousin works in medical charts and she's going to see my chart. So confidentiality is an issue, right? Perceptions of breaches of confidentiality is an issue. So, just be mindful of that and maybe plan around how you're going to work around that in talking with your clients. We know that there's a lack of social services, not just in Indian country, but in a lot of places, right? But think of even more rural or reservation areas where they would not have access to testing, maybe, or have access to condoms, or have access to even fresh vegetables, for that matter. There, in addition to that, can be limited access to comprehensive health care. Where I'm from, if you want to get comprehensive health care, that's about a good 2-hour drive into the town, right? So that's a consideration. We know that Native folks, and myself included, engage in what is known as circular migration. I live in Seattle. I moved here specifically for school. However, I also live in Tucson, and I commute back and forth once a month to be with my family. I go home for ceremonies, for birthdays, for funerals, but I return back to Seattle for school. It's what a lot of Native people have experienced, because the jobs and the education and romance and the drug use, could all be in the city area, whereas all your family, your ceremony, your tradition, and your culture is back home on the reservation. You might have to tap into both environments, to get what you need. And so that's what is referred to as circular migration. There also, and you might as well just bet your money on it. Certainly, we're all working through our traumas, but there are most likely unresolved historical traumas or other traumas that have not been addressed. I'm talking about folks who have experienced urban relocation programs in the 1960s, the boarding schools, Indian boarding schools, any histories of abuse, sexual or otherwise, any of the unresolved traumas, right? And certainly issues, Native-specific cultural risk factors that place Native people at risk also include racism, homophobia, xenophobia. All right. I want you to know that you have the opportunity to make culturally respectful, meaningful mental health services, to provide culturally respectful, meaningful mental health services. There is a pervasive and ongoing need for native-centric or culturally sensitive mental health services, right? It doesn't necessarily exist widespread, nationally speaking. And you have the ability to know and understand trends and needs because of your frontline perspective, and that's a critical role. What you see out in the field informs everybody else of where we should be paying attention. It's almost like I see the frontline workers as steering the ship. What drug using trends are taking place in the community, they're the ones that are going to know about it, and that we can help support the response and interventions and prevention around current or emerging drug trends, right? That's just one example. Again, the piece around confidentiality, for some Native clients, it is an absolute barrier to care and or linkages to care and or retentions to care. Native people may have a personal experience with breaches of confidentiality. Therefore, it is critical we maintain the highest level of confidentiality if we are serious about improving the quality of life for all people, not just Native folks, for all folks, right? So, with regard to engagement, using culture to help this process along. Introductions are absolutely important. Introductions, hi, my name is so-and-so, and shake hands. Shaking hands is a critical, at least that's how I was raised, that you shake hands. That's what I was told to do. Go say hello and shake hands. Not a firm handshake, but a friendly, just kind of warm handshake. I know that's counterintuitive to Western approaches to handshakes, but think of it as like you're reaching out and you're physically contacting, you're saying hello with physical contact, right? That's as far as it has to go. You want to reaffirm clients as experts in their own experiences. And I don't know, but spirituality might be something that does the trick. Whenever I do presentations or attending conference, we typically hold opening and closing prayers. So that might be something to consider in group work. If you want to have, that might be a conversation either you and I have, or you and the ATTC has, or you and local Native community might. Well, actually, that's probably a good idea. Like, if this is something you're interested in doing, spirituality, bringing spirituality into your work, let's have a chat, and maybe I can link you up with some resources in your area. All right. Does everybody know about the 10-second rule? And this is especially hard when we're working with elders, at least for me. So ask a question, and then you have to wait 10 seconds because you want to create space for folks to respond. And it's also kind of like a little facilitator's trick, because if you're silent, that kind of forces the hand for the participants to then have to chime in and make a statement or ask a question. So try it. It's hard to do. I am very impatient in general, so waiting 10 seconds in dead silence and standing in front of a room full of people is a difficult challenge for me, but I do push myself to do it because it is important. Know what's local in your area, what organizations exist. If there are other powwows or health fairs or wellness conferences in your area that are Native specific, show up, right? Attend, check it out. It's really a two-way street, and we conducted a research study in Denver with the urban and Indian community there, and the medical center, University Medical Center, and we asked, what would it take for you to build trusting partnerships with the university? And they said, well, we always go to their events, but they never come to ours, meaning the Denver Indian Center powwows, community events, community feasts, that they never come to our events. And so that was key, right? If it's got to be a two-way street. That's all I got to say. Certainly snacks and water is always nice, and attends to the creature comforts, as my father would say. And if you're able to provide incentives, like a $10 Walmart gift card, by all means do it. The literature does speak to incentives, whether it's a $10 Walmart gift card or a Shell gas card. The literature asks, is the client seeking services only for the incentive, or is it because the client is personally motivated, right? This big question. I actually don't really care necessarily. I think as long as a client is returning for services, as long as they're showing back up at your doorstep, that's that's a success, first of all. But now you have another golden opportunity to engage and build trust. And it gets more and increases the trust and increases that relationship and can only help the work, right? Um, so now let's talk about retention strategies, right? We're just about to wrap up. And retention strategies are sort of, next level. Your groups are going good. How do you keep folks engaged and keep things running smoothly? I would suggest probably even before you started the groups, really to begin building relationships with community leaders. Consistency is vital when building these relationships. Be prepared to inform them of your program intent and progress, and give ample time to process information and ask questions. This is if you're offering mental health counseling and group work in your area, and you're wanting to increase American Indian Alaska Native participation, and there are other Native organizations in the area with whom you want to partner with, this is what that's speaking to. That really giving that ample time to process information probably should have moved to the first part. We also want to get local organizational support, right? So not just Native organizations, but all the partner organizations. So face-to-face outreach is critical. Try to avoid phone calls, emails, and faxes, particularly specifically if you're working or you're trying to outreach to Native organizations. Forget that. It's got to be face-to-face. And if it's a new organization to you, if you have no familiarity, start at the top. Maybe there's somebody on the staff roster who actually is the director of the services you're looking to target. Maybe go that route. Just as you know, it will take multiple attempts, right? Okay, integrating cultural projects such as cultural dancing, beadwork, shawl making, and traditional foods can be a great way to build therapeutic relationships, trust, connection, and knowledge. If we take the professional out, taking the professional out of the professional and creating more of the personal, I think you're setting yourself up for success, right? Working with Native youth, for me, that's not the time to start talking about fancy degrees that I have. It's irrelevant. It doesn't even matter to them. What does matter? Snapchat. So being flexible in that and being able to respond to different groups is also critical. Lastly, reminding clients of Native-specific cultural strengths builds motivation, courage, and healing. Native clients do not hear this information very often. However, I believe Native people know these strengths because they are demonstrated in our stories, among our elders, and through our ceremonies. Sometimes it just needs to be pointed out, reminded of, and built upon. So I put together a list of Native strengths you might want to point out to your clients, that we are all survivors. It's been over 500 years of colonization, and yet we are still here. That our ancestors fought long and hard to ensure that we live long and healthy lives. We are community-minded. We are connected to our past. We are connected to our cultural pride, our languages, our food, our land, and our ceremonies. So with that, thank you very much for your time, and please feel free to reach out. Questions come up down the road, but we'll go ahead and open it up now if there are questions.
Thank you so much, Matt. And yeah, right now we have some time for questions, so please submit them in the Q&A box. The field is at the bottom there. And while we're waiting for questions to come in, I'll just remind everyone that we have recorded today's presentation, so it will be sent out to everyone who attended, a link so you can view it at another time. You can share it with others. Feel free to do that. And I'll also be sending out handouts of the presentation, as Matt mentioned, so you can review the slides later as well. And we are also going to be directing you to an evaluation as we close out today. So please take a few minutes and just let us know what you thought of today's session. And if you don't get redirected, just know that the link to that will also be in the email that we send out. Let's see. So, Matt, I just had a question about the dynamic in the group. If you are running a group and there's yeah, I'm just curious if you've had experiences where relationships between group members can become problematic for the group. What are ways that you've handled that before?
Wow, that's a good question. And it has come up. I'm just thinking back. Takes me a little longer. I'm a little older. So the 12-week psychoeducational group I spoke of was called Steps Towards Change. And it was a 12-week psychoeducational group for gay and bisexual men who wanted to change some aspect of their drug-using behaviors and who were either HIV positive or negative. I think what we did is, because actually in that scenario, we all had individual caseloads, and we would not only promote to the wider agency, but we'd invite folks, clients who were interested and ready to the group. And I think I want to say that, and maybe somebody else can chime in, maybe they have experience, but I want to say that during the initial one-on-one overview, we explained to them that we discouraged sexual relationships between members or romantic relationships because it would compromise or interfere with their treatment. Yeah, Kate, I think it can definitely interfere, absolutely. But how you handle that is the question that I don't have an answer for, and that's a great question, Kate.
Yeah, thanks, Matt. We have another question here that
sure.
I don't know if it's a little vague, so I don't know if Jaden wants to write in and add anything else to it. But she's wondering if you can speak more about research in Native communities.
Well, how much time do I have? Let's get that conversation started. No, what I can say is that I'll give you my perspective as a community member, not even as a research scientist in training. As a community member, the word research makes me nervous. Yeah, I've read and I've seen the photos, and you hear stories, and it's like, and then you know that it's not just Native communities where research exploits have happened, Tuskegee, other communities of color. So if I have that perspective, I know that other members of my family have that perspective. So my thing is always about, it would be great if I could walk into any Native community and pick out a fabulous research question and get right down to work and come up with some great answers and inventions. But the truth of the matter is that we still need to learn what research even looks like in Indian communities. And that is because I think there's a sea change now. I think that there are Native researchers who are up and coming and working with their communities, whereas before maybe that definitely wasn't the case. So what I can say about research in Native communities is that, I think we're embarking on we're continuing on a new relationship. How's that? And that it's something to be closely monitored if you're Native. Is that helpful? That was that was the most rambly answer ever.
No, I thought that was great. Yeah, Jaden. Yes, it was. So hopefully that answered everyone's question. Yeah, thank you so much for sharing that. We have another question here. Do you have resources for starting a voluntary group for young adults ages 16 to 24?
Let's talk, Denise, because I'm actually recruiting for a study right now that's 13 to 18 Native youth, young Native males, 13 to 18. And I'm kind of looking at that myself I just need to know what area you're in because maybe I've heard of something, or well, if you shoot me an email, we can maybe brainstorm together. But thank you, Jaden, thank you, Denise.
Matt, I had one other thing that you brought up.
Yeah.
Was curious to have you talk about. You kind of mentioned in passing using Snapchat, or that's what
Hmm.
people are into, and so I'm curious. Was that just a joke, or have you used Snapchat with clients, or is it something that
With
you
youth,
as a
no.
way to incorporate into?
Well, that's an interesting question because I said Snapchat because look, I'm 40 years old. Facebook to me is still a thing. I bring up Facebook with anyone younger and they look at me sideways. I get it. I'm like, not current, not with the hip trends. Snapchat, you hear a lot of young folks talking about it. So I got on it. And actually, it's kind of fun, whatever. But at least I have an understanding of what it is, even though it's basic and rudimentary. I can say I have an account, but I don't use it. And, I don't know. It's just a way to. Youth were talking about it, and I had to find out for myself. That kind of thing. Yeah. Doing my own research, if you will.
Awesome.
Yeah.
Yeah, great. Well, thank you for sharing and kind of elaborating on at least like how you're engaging with that with clients. That's just helpful to hear your perspective. And yeah, thank you for being honest and vulnerable and sharing this with us. So
No problem.
always appreciate you giving us, yeah, just helping us learn from some of your experience. So
It's helping learn from the many
yeah,
mistakes I've
and
made.
no, not at all.
The multitude of
um,
screw ups I've
well,
done. Yeah.
looks like that might. um, well, yeah, looks like that might be all the questions that we have today. But yeah, I just want to thank you again, Matt, for presenting for us. And yeah, you always offer really great advice and experience and insight based on your work. So thank you for sharing that and for also sharing um, your own cultural experiences that really um, help help us to do better work with um, whether we are native or not, and we're working with natives and doing a better job of that. So thank you,
Yeah, of
and
course.
thank you so much everyone for joining us. Yeah, and go ahead, Matt, if there's anything else you wanted to say as we finish up.
Just thank you very much. Keep in touch, and don't forget the evaluation form.
Wonderful. Thanks again, and yeah, thanks for joining us, and hope you all have a great day.